Hello,
Start. Hello.
hello, hello. This is Dr. Gabra, the doctor in the medical clinic. Are you the daughter of Mr. Donald Trump, 64-year-old?
Yes, doctor.
And how can I address you, please?
Please call me Miss Rose.
Nice to meet you, Miss Rose. So I understand that you want to know something about your father. Is that
Yes, doctor.
correct?
I am very worried about my father condition, and he has recently had some cough and shortness of breath, and he visited your clinic, and he said that you have done a few tests for him, and I just want to know that what is happening with him, doctor. Can you tell me that what is happening with my father?
I appreciate your feeling, Miss Rose, and I expect your father knows about our conversation today. Is that correct?
No, doctor. He doesn't know about this conversation. I just don't want to make him worry for this. So I just want to know that what is happening with him and what can I do for him.
I appreciate your feeling, Miss Rose, uh, but your father has the right not to uh, tell his information except if he consent for that.
What do
And
you
this,
mean by that, doctor? That means you are not going to share anything with me.
I'm sorry, Miss Rose, but it is not, it's out of my hand. I cannot tell any information about your father unless he allow for that.
Okay, did he say that you will not share this information? You will share his health information with me?
I didn't ask him, but I should take his concern before any disclose of his information.
Doctor, I am his caregiver. And you know that after death of my mother I am taking care of him, and it is my right to know what is happening with my father, what I can do for him. Why are not you going for just telling me that? And I heard that he has cancer, so I am so much worried. Just say me that if he has cancer or not.
I appreciate that, Miss Rose, and I know how much you care about your father. But it is really out of my hand. And uh, it is not. I'm not allowed to tell any information, and this totally the right of Mr. Donald Trump, your father. If he allow for that, I I will tell.
Doctor,
Otherwise,
you are suspecting that I will tell him that I have known this information from you. But I swear that I will not tell him that I learned this. Just I want to know that if he has cancer or not, and if I can do anything for him, doctor. If he has cancer, my mother also died of cancer, doctor. And if he has cancer, I think that I am going to lose him. Just I want to take care of him, and I want to do that I can do for him. Just tell me, doctor.
I'm sorry about that, Miss Rose, and I am sorry about all the feeling you are suffering now. But really, I cannot disclose any information from Mr. Donald.
Doctor, I am his
You
caregiver.
can if
Why are you hesitating? I am his caregiver, and I will know in that by turn. Just why aren't you going me, and why aren't you allowing me to take care of my father?
because Miss Rose, I'm so sorry, but it is not my right to, and it is the right of Mr. Donald. It's the his information, personal information, totally confidential. And I cannot tell any information about any patient unless he allow for that. You can simply go to your father and take his permission, and I can tell that time.
Doctor, I told you that my mother died of cancer, so I am sorry for him. And if my father knows that he has cancer, and he will never tell me about this because I will get so much hurt after hearing this. So he will never tell me this. You are the person that who can give me the information, and you are the person who can help me, doctor.
So, Miss Rose, if you think Mr. Donald will not give permission to tell about his information. So there will be a reason for that, and nobody can take this right from Mr.
1 minute
Donald.
remaining.
And this totally his right, and nobody can break his right and break his confidentiality.
Doctor, you are showing your duty, but can you remember? Can you understand that what is going through my mind? I cannot even sleep at night. I couldn't sleep at night after hearing that my father had cancer. I
I'm, so- I'm,
learned it from one of your staff that he may have cancer. He may have cancer, and they are not sure. And I just want to know. I want to
I'm
know
so
from
sorry,
him, doctor.
Miss Rose, about your feeling, but anyone in your father condition, put yourself in your father condition. You will feel bad if somebody break your confidentiality and
Time
tell
up.
other about your personal information. Thank you.
Okay, thank you. So, what was your task?
My task to speak to daughter of Mr. Donald Trump uh, and answer her concern that she wants to know about her father, but without consent. So I should maintain his confidentiality.
Okay, and this she was his next kin, and she was the only caregiver. So why didn't you share the information with her daughter?
Because confidentiality of the patient is his right, and nobody can break unless for specific reason.
Okay. Can you name some reason where you can break the confidentiality?
If there is court, I should need some information. If for the sake of the society opposite the patient, like for example, for contagious disease like HIV or TB.
Okay, and can you tell me that if the patient has no, suppose if patient is mentally unstable, or patient cannot make his own decision. Okay, suppose this patient is somewhat
Competency,
mentally
not
disabled
competent.
patient. So at that time, can you break the confidentiality break? Can you could you disclose his diagnosis?
No, we cannot.
This patient was mentally disabled. Patient couldn't make
I
his
cannot make
decision.
decision and cannot give consent for
Yes,
the family to know about that.
and at that time,
So I think we can tell
could you
the
disclose
family
that?
the diagnosis.
Could you disclose that diagnosis to the patient's party?
Yes, because family has the right to take that time.
Okay, that is fine. And
I'm not sure.
okay, at that time, the patient cannot give any consent for. At that time, you could inform the patient's party that about his condition, and if he has any advance directive or any uh, uh, person who has he has appointed for his health insurance, health or clinical decision. And at that time, you could break the confidentiality because patient has no right. And at this point, it is very important to know about his if he has any advance directive or not. And at this point, if the patient is mentally capable, and at this point, without his consent, you cannot reveal the diagnosis. Okay.
Mm.
Okay.
For any person of the family or only for the
Yeah.
assign.
His next kin. You can ask his next kin about his condition, about his advance directive. lasting power of attorney. So you may not know those, and also patients family has right to know that why you are going to do such investigation, or why you are going to do or why you are going to give such treatment at that point if the patient is mentally handicapped. Okay, you did very well. That at any circumstances you you remained so calm and quiet, and you tried to explain that you cannot break the confidentiality. Okay, so fine. You didn't break down that after hearing the patient's arts or patient's party's request that yes, please tell me about yes or no. You were totally neutral. That was fine.
But I was repetitive. Is it negative one that I'm repetitive? I cannot explain more.
Sorry.
I was repetitive, repeat the same thing more and more without further explanation.
No, this was fine. That you tried to convince me that you cannot reveal that information due to some legal issues. Okay.
And which point we can breach the confidentiality if there is court, if there is
If you have asked that if he has talked about his father, and if you could have asked about that, is your father mentally sound or stable? Is he able to take decision on his own? Okay, you could have asked this point. They are not big deal, but it would be better if you ask this point, that so that you became sure that his father is mentally capable of making decision on his own. Okay.
mm-mm.
And in this case, uh, you have assumed that patient is mentally capable or able to make his decision. You have assumed this, and after that, you continue the conversation. And you could ask to the patient's daughter, so you would be able to give a better explanation that he has the ability to mentally, he has the ability to take decision, and after we are discussing the condition, and you could give her a hope that we will discuss this condition uh, about his condition and about his test results, and at that time I will ask him that if he wants to share this information to anyone, then I will certainly let you know. Otherwise, I cannot reveal any information. And at this time, even I cannot remember all those information that what your father has, so I cannot give you any information. Okay, just giving her hope that you can ask his father, or you also told that you can ask your father on your own. That was fine.
Yes, this best.
Start.
Hello,
Hello.
this Dr. Gabra, the doctor in the clinic today. Are you the daughter of Mr. Donald Trump, 64-year-old?
Yes, doctor. Doctor, are you the treating physician of my father?
Yes, no.
Doctor, I just wanted to talk with you about my father's condition. I am really worried.
Okay, Mrs. Rose, how much you know about your father condition?
Doctor, I came to know from the staff in their radiology department. They said that my father had cancer. I'm so much worried, doctor.
I'm sorry about your feeling, Miss Rose, and I expect your father know about our meeting today.
No, doctor. I am here to request you one thing, doctor. That have you told my father that he had cancer?
Not yet.
Okay, doctor. For God's sake, okay, yeah, I request you not to say this to my father. And you can see that he is so much mentally broken. And after death of my mother, he's so much depressed, doctor. So I request you one thing, that don't say it to my father. I just came to know about my father's condition, and for this, I think you can treat him accordingly. But just one thing that you don't tell my father that he has cancer. Otherwise, he will be mentally broken.
I appreciate your feeling, Miss Rose, but I am so sorry. I need to inform your father about his condition because this is right to know everything about his condition.
Oh, doctor,
I,
I told you that he is so much depressed after death of my mother, and if he again hear this news, I think he will die of heart attack.
I'm so sorry, Miss Rose, but informing Mr. Donald is very important. As after he knows everything about his condition, we will there is too many possibility for treatment of his disease, and he has the right to know each possibility and to give the consent about the treatment.
Oh,
So
doctor,
if we don't tell him, we cannot
I
take
am a
the consent.
caregiver, doctor. I am a caregiver. So you can take my opinion, and I know that what is best for my father.
And can I know uh, if your father is competent enough to take a decision?
Doctor, he is depressed, but I think he can do his job, and he can give consent. But is it very necessary to tell him regarding his mental condition? He is mentally broken, and at this stage, do you think that it will be so good thing, or it will be a work of humanity to tell him that he has cancer, even at his stage?
I'm so sorry, Miss Rose, but as long as Mr. Donald is competent enough to give the consent, it's totally his right to give the decision. Maybe he want the treatment, and maybe he don't want, and it is his right. And every treatment has side effect and has wanted effect and unwanted effect. He should know everything about the treatment option and to give consent about it.
So, doctor, whatever you want to do, you go for that. Just don't inform my father. 1 minute remaining.
I'm so sorry, Miss Rose, but I cannot do that as this is the right of Mr. Donald. And anyone in his place, he he will he will
Oh,
get
doctor,
angry, and he
you are
uh,
always talking about your duty. What would you do if this was if you were in my situation? Would you do this to a person?
sure, it is the right of Mr. Donald, and we cannot take his right. He should know about the condition, and he should involve in his condition and in the treatment plan. Otherwise, we cannot treat him properly.
You can take my decision. I told you that I am his caregiver.
Miss Rose, it's not as long as Mr. Donald is competent, it's not your right to take the decision.
Time
It
up.
is his right to take the decision.
Okay. So,
Thank you.
what was your task?
My task to explain to the daughter her concern, and the daughter wants me not to inform Mr. Donald about his condition, but it is his right to know everything about his condition as a part of autonomy.
Okay, this patient's daughter said that the patient is in depression, and he has recently lost his wife. So, at this stage, do you think that you should inform about his grave condition?
We can involve the psychology team in the treatment, and we can inform him in best way that it doesn't cause further harm for him. But it is his right to know about his condition.
Okay. So that you mean that you, at any cost, you are going to reveal his diagnosis.
Yes, because this is his right, and he should give decision about his treatment.
Okay. So by doing this, what ethical issues you are involving?
Autonomy, consent, giving consent to the treatment.
Okay. Fine. And is there anything? Is there any issues where you could hide this information from the patient about his diagnosis? Was there any issue? Do you know any of those?
I don't know any condition that we should not inform.
Okay. And about this condition, yeah, you have explained everything well. Okay. And you have answered to the patient's concern, patient's party's concern, and you told her that you cannot take decision on your own. Patient has the right to know about his condition, and then he can give consent to disclose this condition to others, or he can give consent to further management plan. So this was fine, totally fine. Okay, thank you. Do you want to add
Thank
anything
you.
for this case?
Sorry?
Do you yourself want to add anything for this case?
I want to ask if there is any condition that we cannot hide